Thank you very much, Professor Rajan Singh, Dr. Saroj. What a high-powered chairpersons I've got. Thank you very much for coming here. Good morning, ladies and gentlemen. A 93-year-old man married a 25-year-old woman, starlet. He for her youth and she for his money. And everything was fine. 1 year later, sure enough, they had a baby girl. And this man went around the neighborhood distributing sweets. Everything was all right till he met Professor Rajan Singh. Rajan said, last week I was at Kaziranga Sanctuary and I saw a tiger advanced towards me. I opened up the umbrella and talked. The tiger died. Impossible, said the man. Someone else must have fired the gun. Rajan Singh said, that's what I'm trying to tell you. Someone else must have fired the gun. That's one way of getting pregnancy and getting over erectile dysfunction. But what I've got to tell you today is going back to the nature. Mind, body, and sex. I'm sure all of you know that male sexual dysfunction is one of the commonest health problems affecting men and seen in all ages, ethnicities, and cultural backgrounds. It used to be said that testosterone decreases 1% every year from the age 40 onwards. But now with the changing trend, it's I think more like 30 when the so-called burnt out syndrome starts to occur, and that's reducing the testosterone levels. Approximately 31% of men suffer from sexual dysfunction in their lifetime, and despite all the prevalent disorders, these are not addressed. Because you're not going to say in a party that, hey, I suffered from sexual dysfunction, I went to Dr. Rajan Singh. In a party, nobody wants to talk about the personal problems. And therefore, the disease is hidden like a high iceberg. Let me start from the beginning. The male sexual response consists of 4 different phases. The first phase is the desire. The second phase is arousal and erection, and followed by orgasm, ejaculation, and resolution, and then follows the refractory period where no crane in the world can lift the damn thing up. Another thing that's to be noted is that there is a decline in coital activity with age in men. So if there are 500 encounters at the age of 25, by the time you are 50, the encounters become half, 25. Now, except that there are a few exceptions to the rule, like Professor Bali Brahmbhatt and Rajan Singh. But by and large, as age advances, there is a decrease in sexual activity. And the third important thing that I want you to realize is that the king of the jungle, the lion, he can do it in 20 seconds. So all of you who can do it for more than 20 seconds, you are a king. Let me talk about the physiology of erectile dysfunction. It all starts in the limbic cortex, where as a result of fancy, you think of Aishwarya Rai. No, I think it's Deepika Padukone these days. Alia Bhatt, even better. Well, you've got to have a fancy. And that goes on and attacks the limbic cortex. Then there are special sensory stimuli which affect the limbic cortex. And that sends a message down the lumbar parasympathetic, which is nitric oxide related, to cause arterial dilatation and cavernous relaxation. And the penis enlarges. But that's not all. There has to be a proper blood supply. There has to be genital stimuli. And let's not forget the good old testosterone. Poor penis. It has to go through so much before it gets an erection. And women don't seem to realize that. You have one small event with your boss and the penis stops to get a raise. It is so sensitive. And that's because it's dependent on so many pathways. And therefore, it is important that we talk in terms of holistic approach. not just treating one part. Just curing the testosterone is not going to help. You need to address the other factors also. And that's where the non-surgical management of erectile dysfunction comes into fashion. Sexual counseling is the prime thing that we have all been discussing for the last one day. Oral drugs, hormonal therapy, and use of phytonutrients. This new field of use of phytonutrients is very exciting to me because it produces more orgasms than a man can imagine. Up to now, we've been relying on oral drugs. Viagra or Penagra, that sildenafil citrate, is a very good drug, but it's beautifully marketed. And nothing can show it more than this slide, where the strength of the penis is remarkable. But all medicines have got side effects like headache, flushing, dyspepsia, nasal congestion, altered vision in Viagra, myalgia with Cialis only. So all these Western medicines that we give have got their own drawbacks, they have got their own problems. And wouldn't it be better if we had something which had less side effects and more effects? And to top it all, concomitant use of nitroglycerin in any forms, that is in cardiac diseases, can potentiate the hypotensive effect of PDE5 inhibitors or vice versa, and we can have a precipitous fall. Imagine a person coming to the casualty, having had taken sildenafil, and the casualty people do not know why there is such a precipitous fall of blood pressure, and pump him with adrenaline and all sorts of things. It can lead to chaos in the body and may even result in death. So we come back to the old nature. Nature is wonderful. And that's where we talk about nutraceuticals and male sexual dysfunction. Its sexual function is a result of not just vascular problems, not just nerves problems, but it's a result of micronutrients which are present in the human body. We do not give any stress to that. But the important point is that dopamine, serotonin, nitric oxide, these are all the elements that are required to produce an erection. And where do they come from? From micronutrients, from phytonutrients. And that, therefore, the nutrients have a role in regulating hormones and enzymes essential for normal sexual function. Eating specific nutrients may contribute to promoting sexual health and improving one's quality of life. But the problem is that the amount required is so much that it's physically impossible for a person to take it. I once told a lady that give your husband tomato as it's got antioxidants. It helps in infertility as well as in erectile dysfunction. 1 week later, the man came to me, save me, mujhe bacha lo. I said, what happened? He says, I'm getting tomato for breakfast, tomato for lunch, tomato for dinner, and so much so that I'm smelling of tomato now. But still, that's still not enough. So if it was replaced by a tablet which contains the exact amount of tomatoes that's required or other micro ingredients, that would be much better. And that's why we take a healthy diet, but still we need these supplements. Fenugreek. Now, fenugreek, we have been taking it for ages. It's part of the part of the Indian masala that we prepare. Fenugreek is methi seeds. But again, as I'm saying, if you take methi, you have to take maybe a kilo a day to get the same effect as you would get from a small tablet. And it's now cultivated almost all over the world. And leaves, the seeds are commonly used as leafy vegetables. And not only does it help the erectile function, it also is an anti-diabetic, antiseptic, aphrodisiac, and it causes diverse health benefits, and that we know for centuries now. It's like HallB or turmeric. The West has now realized that turmeric has got a lot of importance. Similarly, methi or fenugreek seeds, people have now realized that it's very important. And it's about time we here in the Asia took charge of the situation and talk more about these locally grown products than talking about sildenafil or other PDE5 inhibitors, which are used only as an emergency medicine, but do nothing for curing the products. No, they're not getting fenugreek seeds. Different active components, and I'll tell you why fenugreek seeds are so important. Because they contain steroid saponins. This is aphrodisiac, anti-inflammatory, and has uterus and lactation stimulated properties. What do these steroid saponins do? I'll come back to it later. But they also got polyphenolic flavonoids, which cause hypoglycemic, hypercholesteremic, hypertriglycemic, and antiperoxidative. Clearly, this helps in diabetes. So we're talking about diabetes being cured by this, and once the diabetes is better, erectile dysfunction also gets better. All are interlinked. Polysaccharides such as galactomannans contains anti-diabetic effects. And again, amino acid 4-hydroxyisoleucine contains insulin mimetic property. And look at this. This is a study in 2017 again, and 2016. The very recent studies that are now coming up, where a significant number of studies have demonstrated the product potential of fenugreek seed in extracting, boosting testosterone levels, muscle building, and sexual health. And even FDA has now certified as a safe drug. What is the mechanism? Very scientific. In the body, the testosterone exists as a free testosterone that is not bound to anything, and as bound testosterone, which is bound to sex hormone binding globulin. That which is bound to the proteins is not available for normal activity. It has to be in the free form. So therefore, even though the total testosterone may be very high, if the free testosterone is low, then it will not work. What fenugreek seed does, it has a structure which is similar to the free testosterone, similar to testosterone. And this is where you see. See the free testosterone and then this SHBG bound testosterone. And there comes the role of saponins. Saponins are the ones that are present in fenugreek, I told you. If they can displace the testosterone from the SHBG, you will have more free testosterone. And more free testosterone means more activity for the body. This is what is required. And this is where it is different from TRT, or testosterone replacement therapy. Because in testosterone replacement therapy, you are replacing outside testosterone with the endogenous testosterone. It results in depressing the already depleted endogenous testosterone even further. Whereas if you give fenugreek seeds, you are actually boosting the testosterone produced by the body. Very big difference. If you give the testosterone from outside, the exogenous testosterone, you'll have more side effects. You'll have less side effects or no side effects if you use the saponins to replace the testosterone and make it a free testosterone, which is already produced in the body. And this is what happens. So you get more free testosterone, and there is physiological free testosterone by the use of a natural product. So much so that the Aging Male had a special article on testofen, which is again fenugreek seed extract, and it reduces age-related symptoms of androgen decrease, increases testosterone levels, and improves sexual function in healthy aging males in a double-blind randomized clinical study. And they concluded that the fenugreek seed extract is a safe and effective treatment for reducing symptoms of possible androgen deficiency, improves sexual function, and increases serum testosterone in healthy middle-aged and older men. So the moral of the story is that if you want an erection like this, take natural products like saponin or fenugreek seed. I can see my Japanese friend nodding her head. Would you like to tell us something about this very unique festival in Japan? Would you just tell us something about it? On 1st April, once a year, And I believe in Kawasaki there is a special festival to bless the penis and get Shinto or temples to bless the penis, especially in case of infertility. Am I right? There's a symbol. Right. So very, very fascinating. They have a special day where they have a penis, penis being taken around the city and revered. Yes. Yes. So, but it's not taken out as a procession. So we find that Japan is more advanced, sexually speaking. Sexually. But anyway, in all the countries they have this sort of a thing. It is camouflage, it is under the bed sheet, but in Japan they make no bones about it, and they have it as a tribute to God. Let's talk about L-Arginine. L-Arginine is another natural product. It's an amino acid engaged in several metabolic pathways within the human body. It is involved in the production of various enzymes, hormones, and structural proteins, and has important roles in sexual function and muscular activity. For those of you who want to become like Rajnikant, here's the formula. Take L-Arginine. Doses up to 30 grams per day have been generally well tolerated. Most common adverse effects of nausea and diarrhea are being reported infrequently at higher doses from 15 to 30 grams. But the dose of L-Arginine is only 5 grams a day. So it's a very safe product. It's a biological precursor for synthesis of nitric oxide, essential messenger for penile erection. Long-term oral administration of pharmacological doses of L-Arginine improves the erectile response in patients with ED. And arginine is required for normal spermatogenesis. That is in cases of, not only in case of erectile dysfunction, but also in infertility, it helps. And as I said, if you want a Rajnikant body, it also helps. Athletes take arginine for 3 main reasons. Incidentally, arginine is the one that escapes the drug tests. So athletes can take arginine and get away with it otherwise. And athletes, its involvement in synthesis of creatinine, in role of augmenting nitric oxide. You see, L-Arginine acts in a different way. Fenugreek seeds, they increase the free testosterone, one mode of action. L-Arginine, it acts at local level by increasing the nitric oxide. Now, nitric oxide is a product that helps in causing the vasodilatation. There are 2 types of nitric oxide, the eNOS and the nNOS. eNOS is the one that is released by the endothelium, and the nNOS is the one released by the nerves. They are both nitric oxides. But eNOS initiates the dilatation of the vessels, which is then maintained by the nitric oxide relieved by the endothelium of the vessels. So they stay open. And therefore, the precursor is L-Arginine. The difference between this and PDE5 inhibitors is that nitric oxide acts at the entry level, whereas PDE5 inhibitors act at the exit level. So imagine a room full of people with the exit closed. You add a few more persons and there'll be stampede, there'll be a problem, suffocation. But if you keep the exit open, as in case of nitric oxide, you keep on adding nitric oxide, but the people will escape from the exit. So it is safer than giving PDE5 inhibitors. Clinical evidence effect of oral administration of high dose of nitric oxide in men with oral erectile dysfunction. This is a study that was done, and let me just go down to the outcome. All 9 patients treated with L-Arginine who had subjectively improved sexual performance and had an initially low urinary nitric oxide. And this level had doubled at the end of the study, not surprising at all. Then this is another study that was done. For paucity of time, I'll just skip it. Conclusions: the present trial showed that daily consumption of 5 grams of L-Arginine for 4 weeks in T2D men with mild to moderate sexual dysfunction improves various parameters such as erectile function, sexual satisfaction, sexual desire, pleasure from sexual intercourse, and testosterone level. So you see, all the parameters are being addressed. Not just erectile function, but also libido problems, also orgasmic problems, also sexual satisfaction. What are the other stuffs that make penis stand out like that? Zinc. This is the most critical trace element for male sexual dysfunction, and it plays a role in production and secretion of testosterone from the Leydig cells. Low zinc levels may lead to gonadal dysfunction and other problems with the testes. Prevalence of zinc deficiency might be as high as 40% worldwide. And zinc is another trace element that is present in many foods. It is part of a combination of phytonutrients that you all can see on the seats. It's just the name that's written there, not the actual sample. Mechanism of action: zinc increases testosterone levels by following the mechanism of action. It increases the conversion of androstenedione to testosterone. It interferes with the metabolism of testosterone by decreasing its hepatic clearance, and is also essential for action of testosterone, since testosterone receptors contain zinc. And there's a trial which says exactly the same thing. Magnesium is another essential ion involved in multiple fundamental physiological functions in humans, mostly investigated material in mineral involved in muscle function. After going through these slides, I actually treated a patient with magnesium tablets. And to my utter surprise, he had the most powerful erection when his wife was out in the market. So he phoned me up. I said, well, call your wife back then. She says, no, I can't. I don't have a phone number. She hasn't taken a phone with her. Then I said, why don't you try the maid? She's there. He says, no, doc, I never had a problem with the maid anyway. So you can never win. There are chances like that. Anyway, magnesium is one of the stuffs that can be used, and sometimes it gives dramatic results. It affects the male gonadal system. Another stuff is pyridoxine hydrochloride, which may be involved in making the steroid hormones like testosterone. Now, ladies and gentlemen, what I want to say is that the therapy has got to be holistic. You've got to treat the psychological aspects, you've got to treat the body aspects, you've got to treat. What is most important nowadays is micronutrients.
Ajit, you have 1 minute more for ejaculation.
That's far too long. At my age, it's all in the mind anyway. So I'll come up to the summary then, and I have a premature ejaculation. Selected nutraceuticals act synergistically to promote libido and improve sexual health. Significant improvement in free testosterone. Improvement in erectile response by enhancing the generation of nitric oxide. It has beneficial effects on body weight, muscle size and strength, and improves in energy and well-being, sperm counts, motility, better tolerability profile, and can be safely administered, especially in diabetes and hypertension, and can be, now this is important, can be safely administered in patients with nitrates, which sildenafil you cannot. Ladies and gentlemen, it's been a pleasure talking to you all. I thank you all for your patient hearing.